Well, today on the show, we're at South Mississippi Surgeons, and we've been visiting with them several times over the years and finding out the different things that they deal with when it comes to surgery. And Dr. Edward Dvorak, how are you, sir?
Nice to meet you.
Nice to see you. And give us an overview, if you would, about South Mississippi Surgeons.
Well, we're a group of general surgeons. There are 6 partners, and there's 8 of us currently. Right now, we do all manner of general surgery. We do bariatric surgery, but my focus is hernia, as well as Dr. Simpler, and we fix all manner of hernias, from inguinal hernias in children all the way to massive incisional hernias in adults, complicated hernias, hernias that require special treatments. Now,
let's talk a little bit about hernia surgery. I've been there. Having a hernia is painful. And then I guess there's some things that when it first started out, mine started out as a little thing that just kept popping out. Now, are there other things that could kind of give you a signal that you might have a hernia?
Well, hernias are holes in the abdominal wall, and as far as hernias in males, most of the time they present with either pain or a bulge. In females, they're much more difficult to diagnose, especially inguinal hernias typically present only with pain. There is no bulge that's visible. And hernias in women tend to be more of a challenge as far as diagnostics.
What are some symptoms?
Mainly, if it depends on where the hernia is. If it's an inguinal hernia and the patient is thin, most of the time a male will notice bulge. Like I said, the female will typically not see a bulge, but she'll notice pain in that area. And it's difficult to feel an exam. On exam, it's difficult to feel a hernia on a female.
Right.
Yeah. As far as inguinal hernias, those are very common in children. And what I wanted to talk about a little bit today is pediatric hernias. Or hernias diagnosed in children.
And thinking about that, you really wouldn't think that much that kids could get hernias. Kids play a lot or whatever. What is the youngest that you've dealt with as far as a child having a hernia?
Well, certainly neonates present with hernias, because hernias in children are a little different than hernias in adults, in that hernias in children are hernias that the children are born with. They're holes in the abdominal wall that don't close when they're supposed to during development. The 2 main areas are hernias in the inguinal region or the groin, and hernias at the belly button or the umbilicus, umbilical hernias. Those are the 2 main hernias we see in children. These are some of the most straightforward and simple problems we deal with as surgeons. As far as inguinal hernias or hernias in the groin in children, those need to be repaired when diagnosed. So even as early as 1 week old or 2 weeks old,
wow.
If that child goes home with the mom and comes back for the well baby check diagnosed with an inguinal hernia, if the child is otherwise healthy, that hernia really needs to be fixed, because these are the types of hernias that incarcerate or strangulate, meaning the intestine gets out there, swells, and that becomes a surgical emergency. Is much more difficult to deal with, much riskier. And the thing about children is they have very little or no intra-abdominal fat. So anything that's coming through that abnormal opening is going to be intestine. And that's where kids get in trouble, and that's why we fix inguinal hernias when we diagnose them. As far as umbilical hernias, most of those can be treated non-operatively, observed until age 3 or 4, unless there's an extenuating circumstance why you want to repair that, and that's generally up to the judgment of the pediatrician. At age 3 or 4, most of those will have closed ordinarily. If they don't close by age 3 or 4, we consider going ahead and repairing those hernias. As far as the repair for inguinal hernias, there's generally a sac associated with the hole. Just tying off that sac is really sufficient to go ahead and fix that hernia. And recurrence rates for inguinal hernia repair in children are extremely low. They approach 0. And for that reason, we don't need to use mesh or any other type of hernia materials. You simply close the hole, the patient heals. Kids heal really fast, their tissues are great, have great blood supply, and so there's no need for hernia materials. As far as umbilical hernias, if the child still has that hernia at age 3 or 4, we'll go ahead and do a simple repair. These are all outpatient repairs through a 1-inch incision or less. We'll go ahead and close that hole. It's outpatient surgery unless there's an extenuating circumstance. Sometimes in the younger kids that are born premature, The younger kids that we're doing inguinal hernia surgery on, we'll go ahead and admit those folks overnight on a monitor. But those are rare circumstances. In an otherwise healthy child, these are all outpatient procedures done through very small incisions. As far as postoperative pain control, children really don't require any type of narcotics for pain. In fact, what I tell the parents is
They're pretty resilient.
Absolutely. By day 1 or 2, I tell the parents the next day they're going to be doing things that you don't want them to do with no pain medicine at all. And Tylenol and Motrin generally more than adequate to control pain for the first 24 hours. I generally see my patients at 2 weeks just for a wound check. But again, the great thing about kids is that they heal. Wound complications extremely uncommon, and recurrence is almost unheard of.
Wow.
Yep.
Pediatric hernias, is it something that's common?
Very common.
Really? Because honestly, I've never heard that much about them. You hear about adults getting hernias all the time, but as far as kids, but as you said, a lot of them are born that way.
All pediatric hernias are essentially congenital, meaning the child is born with the abnormal communication, and then this has to do with development and what the abdominal wall is doing during development. In the umbilical hernia's case, it's basically a communication for the umbilical cord, the blood vessels from the fetus to go to the mother. Mm-hmm. And then, of course, that hole is supposed to close after you cut the umbilical cord, and then that all heals. That hole is designed to close. Sometimes it doesn't, and that's what an umbilical hernia is. Mm-hmm. But very common. Inguinal hernia is almost exclusively in boys.
Right.
Yeah.
Do you see a lot of kids, pediatric, I guess that's up to what, age 15, 16, or maybe younger than that? Yeah,
as kids get to be 15, 16, we will treat them more like adults. Mm-hmm. And depending on the patient's size at age 15 or 16, we might even consider using mesh, depending on what that child's activity level is, what the body habitus is. That's kind of the age at which point you start thinking about maybe a laparoscopic repair in a child. But as far as age 4 or 5 neonates, we certainly don't need to use mesh, and those are typically done through tiny little open incisions.
Wow, That's really interesting. Dr. Edward Dvorak, how are you? I appreciate you giving us some information on pediatric hernias, which is something, again, you wouldn't think that was that common, but they are, and I could imagine when a child is born or whatever, they probably know then if the child has a hernia and needs to seek your services.
Absolutely.
All right. Thank you so much again. If you want some more information, what you can do is, of course, all the information is on the bottom of your screen. South Mississippi Surgeons located here in Ocean Springs off of Highway 90. For any type of surgical needs, I'm sure they'd be glad to help you out.